Good morning. I'd like to thank you all for joining for the County of Santa Clara MedAssist brand reveal. Without further ado, I'd like to introduce Supervisor Joe Simidian, who is the county's Health and Hospital Chair.
Good morning, and thank you. And little did I imagine when I came back to the Board of Supervisors some years ago that I would have occasion to show up with a piggy bank in my hands, but here we are, and if this is what is necessary to make sure that even more folks here in Santa Clara County are the beneficiaries of our MedAssist program, then I am happy to be here along with the friend that each of us will be able to walk away with as part of today's conversation. And Supervisor Otto Lee, who's going to speak in a few minutes. Supervisor, don't I remember that one of your daughters was born in the year of the pig? All right, so this is a doubly auspicious occasion. Before I begin my remarks, however, I would like to turn to my left, your right, to the folks who have actually been making the MedAssist program work for us and ask you to give me a little help as we thank them for their work. And I'm going to do that one more time because the MedAssist team was a little shy and apparently unwilling to give themselves applause. Trust me, I work with elected officials, and self-applause is a regular thing, all right? So go. There we go. I really am pleased to be here. I'm County Supervisor Joe Simidian, as you heard, and it was 3.5 years ago that my office and I asked our colleagues on the Board of Supervisors if we could make a commitment to make sure that life-saving, life-essential drugs didn't cost an arm and a leg here in Santa Clara County. And MedAssist, the program that we are here to refresh and rebrand just a little bit, MedAssist is our program to provide financial relief to County of Santa Clara residents who need assistance paying for asthma inhalers, diabetes medications, EpiPens, all of which are extraordinarily expensive, and yet all of which are life essential. Now, to give you some sense of the scope of the importance of a program like this, just a couple of quick numbers, and I promise I have just a few. More than 20,000 Santa Clara County residents are prescribed EpiPens is the brand name, auto-injectors, epinephrine, but more than 20,000 folks have been prescribed these high-cost EpiPens. More than 100,000 folks here in Santa Clara County have diabetes. More than 250,000 folks here in Santa Clara County have asthma and probably need an inhaler. All of these products, life essential, highly expensive, and frankly, forcing people to make choices in their daily lives that no one should have to make in terms of, do they get the medication they and their families need, or do they put food on the table, or do they pay the rent? So even with health insurance, and not everybody's insured and not everybody has good insurance, but even with health insurance, the average out-of-pocket cost for patients who are using one or more of these medications is probably something like $500 a month, month after month after month, quite possibly for the rest of their lives. Now, one of the things that we're going to talk about today is the fact that as we have worked with the program over the last few years to figure out just how we can make the program even more useful, pull more folks into the MedAssist effort, we now have a program that serves folks that are in the so-called missing middle, people who make what we used to think of as a pretty good middle-class income, but who are struggling with the high cost of living in our county and with the extraordinarily high cost of these particular drugs. So today, if you are an individual making more than $100,000, you probably qualify for MedAssist. If you're in a family of 4 making more than combined household income of $250,000, you probably qualify for MedAssist. And if you're using those asthma inhalers or EpiPens or diabetes meds, you probably qualify for MedAssist. Now, the fundamental announcement today in terms of the program's redesign and relaunch is that we now are including children who were previously not part of the program, and we have these higher income levels that I think will make the program even more responsive to the need that exists in our county. And because I know Nairi's going to want me to do this, one of the benefits of this program is not just the financial relief that it provides, and it does for those of you who missed this earlier, but the medication adherence. Now, what is medication adherence? Well, it's a, no disrespect, it's a term of some technical significance. It's a little bit jargonistic. What it really means is, do people stay on their meds and keep themselves healthy? Do they stay on their meds and keep themselves healthy? And they can't and don't if they can't afford the drugs. They can and will and do when there's a program like MedAssist. And we're going to hear a little bit more about the really impressive increase in the number of folks who are staying on their meds, keeping themselves healthy, because now they can. There is no age limit now for qualifying for the program. We have, with the help of good people who are here, already achieved our first milestone. I was pushing. That's the polite word for what I was doing. I was pushing our health and hospital system to get to 1,000 enrollees, and we have hit that number, gosh, back in June now. Seems so long ago. I asked recently, how we doing? Are we still on the program? Team said, yeah, no, we're at 1,300 plus now. And then before I came today, they said, oh, no, we're at 1,400 plus now. So I'm going to throw out the 5,000 number. And everybody just went, excuse me, what? Yeah, no. There's no reason we can't get to 5,000. They were hoping for 2,000. They were hoping, I'd say, 2,500. I'm throwing out the 5,000. So the reward for success, MedAssist team, the reward for success is ever higher challenges, ever higher goals, but most importantly, ever more help for people in our county who need it. Better med adherence, folks who don't have to make hard financial choices. Let's get to that number. I'm not going to put a time on it. I'm just going to say I will be nudging until we get to that 5,000 number. And we have work to do, because as part of the effort to make sure folks in the county know about MedAssist, we've done the deep dive, we've done the research. Thank you to the team for that. The research, however, suggests that literally just 7% of county survey respondents reported they had heard of the MedAssist program. And that's why I said, if I have to be out here on a beautiful morning with our piggy bank to get folks to pay attention to the fact that there's a way to keep themselves healthier and to provide for their family, I will do it until we get to 5,000. And then ask me when we get to 5,000 what the next goal will be. So we are enhancing our outreach efforts, as your attendance here this morning suggests. We're going to do that with the unveiling of our new program branding, about which you'll hear a little bit more in a moment. Please take a flyer if you haven't already had a chance to do that. And I would be remiss, and I don't want to be remiss, if I didn't both acknowledge but thank my colleague on the Health and Hospital Committee, Supervisor Otto Lee, who has been a steadfast supporter of this program since we introduced it 3+ years ago now. And please join me in welcoming my friend and colleague, Supervisor Otto Lee. Supervisor, I'm going to give him the COVID fist bump, pig bump. There you go. Okay, you got it.
Good morning. Thank you so much, Joe, Supervisor Midian. It's truly an honor to be here today to work with you on this program like MedAssist that you've championed on the Health and Hospital Committee. My name is Otto Lee. I'm one of the supervisors representing District 3 and excited to support this program for Santa Clara County residents and, of course, encourage all our neighbors to consider applying. MedAssist is helping families, those missing middle, to cover the medical costs and out-of-pocket expenses for these life-saving medications. Increasing and expanding access to this program is a big boost to our community, especially because the MedAssist application process is just so simple. Our program staff will ensure that the application process is easy and seamless, right? That's what you guys will be doing. And then once accepted, the participants will actually receive a quarterly check to help pay for their medical bills and bills of prescription drugs and these life-saving medications that are so important to everybody's living every day. The application process is truly accessible to everyone. Go to the getmedassist.com. Let me say again, getmedassist.com to apply online and download the paper application as well and submit it to any Santa Clara Valley Medical Pharmacy locations. The phone number along with the program information and support is all available in multiple languages online. MedAssist enrollees simply complete a very simple and short clinical questionnaire at the start of the program, in which asks about the health outcomes. Compared to the standard rates cited in literature, we found out that those MedAssist enrollees, those 1,400 we talked about, actually had a 50, I say that again, 50% lower rates of visits to the emergency room. There's also a substantially higher rate of medication adherence for asthma and diabetes, improved rates for control of asthma, and for diabetes as well. Ultimately, medical adherence means reduction to other much more serious complications, leading to, of course, much better patient outcomes and healthier community, of course, less pressure and cost to our health care system overall, which also means our healthier community. We really should not have to have our residents to decide whether to pay for life-saving medications or their food. We're seeing this situation during COVID when financial strain has been so severe. We absolutely can't neglect caring for our health because we are afraid of these important but very high costs. The county is here to help, and I'm here to ask everyone to help take care of yourself, take care of your health, and now if you have not done so, go to the website. Go to the website and look to see if you can file and apply for this very, very easy to apply for but important program, because you will get this assist 4 times a year quarterly check to help pay for this prescription. No matter where you get your care, whether through the Valley Medical System or other healthcare system, you could still get support with these expenses if you qualify for MedAssist. So I look forward to watching how this program will grow. My colleague Joe mentioned 5,000. I would say, why not 10,000, right? Let's go there. Let's go there. And I'm really hopeful that our community outreach will get more families to sign up as soon as possible. And I'm truly excited for this unveiling of the new marketing campaign for MedAssist. As the hint goes, as you can see, how much money, why we use this piggy, is because if you look at the top, there's a little slit here, just like a piggy bank. This program will help people save money. That's exactly what this is about. And thank you so much for being here today. And again, thank you so much for the MedAssist staff for all your good work. Let's get to 10,000, all right? Thank you.
Thank you so much.
Go ahead.
Good morning. I am Nari Singh. I am the program director of MedAssist. And I believe at this point we will be doing the big reveal of our MedAssist mascot.
There we go. Why are we standing with this MedAssist pig?
We are standing with the MedAssist pig to inform our entire community how important it is for them to take their medication every day, day after day, as their physician has prescribed. And the county is here to help. This is our new mascot. So now more than 1,000 people have been involved in identifying or selecting the logo and the mascot. I do want to start by thanking a few people, Supervisor Samidian and Supervisor Lee, for their vision and for them continuously telling us that this is a program that needs help and continuously pushing us to take this program to the next level. County Executive's Office, James Williams, and Chief Operating Officer, Greta Hansen, for helping us through the program, and Paul Lorenz, my boss, for guiding me. And Paul, this program would not have been here without all your support. I also want to call out a few names, Karen Pannu and her team for making this program and reaching the first milestone. Michelle Honda and her team for helping us through the entire marketing process, and our media partners. Where is JP Marketing and JP Marketing's team? These guys have been awesome. So regarding our new logo, as you will see, the new logo has two hearts coming together. One heart is the heart of the MedAssist program, which genuinely cares about the health and well-being of residents of Santa Clara County. The second heart is the heart of the recipients who rely on the support of MedAssist to stay healthy. So those are the two hearts that come together. As the two hearts overlap each other, that represents the connection and the commitment of the program to all the residents of Santa Clara County. This also includes the missing middle population. The missing middle are the people who have insurance but have to pay substantially high amount of out-of-pocket cost for their life-saving medications. These are the diabetic medications, asthma inhalers, and the EpiPen medication. So if you look at the middle of the logo represents the support for the missing middle. Isn't that awesome? Now, along with the brand new logo of the two hearts, we also have the new mascot. And if you look at on my left side, this is the piggy bank mascot for MedAssist. A piggy bank universally represents financial savings. Since the inception of the program, we have been using the image of the piggy bank to represent the financial assistance that the applicants receive when they apply to MedAssist. This is a friendly, distinctive, and a cheerful sign that clearly indicates that the program will reduce financial burden to the enrollees and help them get better care. Here at the county, we plan and strive for healthier communities, and the programs like MedAssist help us take our communities to that healthier level. We are hoping that this new logo, along with the marketing and outreach activities, will give the program a sense of identity within the community. We want the community to see this double heart and immediately think of MedAssist and the care the MedAssist provides. So if you are taking life-saving medications, call us. Apply at getmedassist.com. The application is simple and the staff is here to help. Once you are approved, you will start getting your financial grant within 30 days. You can continue to pick up your prescription from the pharmacy of your choice. That continues as usual. Once you have your medications, we want you to take your medications as prescribed by your doctor. It is extremely important that you continue to take your medications because that is what medication adherence is, that is what this program is about, and that is what will keep you out of the emergency rooms and out of the hospitals. Now, to talk more about how the program helps and keeps our people healthy, I would like to introduce Dr. Lori Kamen, who is one of the Santa Clara Valley Health's wonderful pediatrician. Dr. Kamen.
Good morning. I'm honored to speak with you today about the MedAssist program. I'll speak first in English and then in Spanish to share this important information. Buenos días. Es un honor para mí hablar con ustedes sobre el programa MedAssist. Hablaré primero en inglés y luego... Oh. I'm too short. Thank you. Buenos días. Es un honor para mí hablar con ustedes hoy sobre el programa MedAssist. Hablaré primero en inglés y luego en español para compartir esta importante información. The MedAssist program makes life-saving medications more affordable and is available to thousands of people in our county. The eligibility criteria for this program are all ages can apply, including parents of children under 18 years of age. Applicants must live in Santa Clara County and have a valid prescription for an asthma inhaler, diabetes medications, or an epinephrine autoinjector, or EpiPen. And they must meet the household out-of-pocket healthcare spending and annual gross household income requirements that are listed in the getmedAssist.com. Many people will qualify for support and can enroll at any time online. It's easy to apply, and the program and program staff are available to help with the application if needed. I'm a pediatrician, but I'm also a mother, and I have a child who has severe food allergies. So I know the peace of mind that comes from having an EpiPen with us at all times in case we need to use it to save my daughter's life. But in my practice, I see patients who can't always afford to have their medicines they need, or who skip doses or reduce their doses to make their medications last longer. I've seen children who are having trouble breathing, who didn't use their asthma inhalers, and children who have poorly controlled diabetes because they skipped their doses of the prescribed medication. And I've seen families who lived in fear of not being able to save their child if they had a serious allergic reaction because they didn't have an EpiPen. Not taking your medications as prescribed can lead to worsening health problems, increased hospitalizations, and even death. That's why it's so wonderful that MedAssist grants make it easy and affordable to take life-saving diabetes medications regularly, to use asthma inhalers, and have EpiPens available. That means parents and their families can have the peace of mind that comes from knowing that they have the medicines they need when they need them. El programa MedAssist hace que los medicamentos que salven vidas sean más asequibles y está disponible para miles de personas en nuestro condado. Los criterios de elegibilidad para este programa son: pueden postularse todas las edades, incluyendo padres de niños menores de 18 años. Los solicitantes deben vivir en el condado de Santa Clara y tener una receta válida para un inhalador, para el asma, medicamentos para el diabetes o un autoinyector de epinefrina o un EpiPen. Y deben cumplir con los requisitos de gastos de bolsillo en atención médica y de ingresos brutos anuales del hogar que se enumeran en getmedAssist.com. Muchas personas califican para recibir apoyo y podrán inscribirse en cualquier momento en línea. Es fácil presentar la solicitud y personal del programa está disponible para ayudar con la solicitud si es necesario. Soy pediatra, pero también soy madre y tengo una hija que tiene alergias graves de los alimentos. Yo conozco la tranquilidad que se obtienen al tener un EpiPen con nosotros en todo momento. En caso de alguna vez necesitamos usarlo para salvar la vida de mi hija. Pero en mi práctica veo pacientes que no siempre pueden permitirse el lujo de obtener los medicamentos que necesitan porque saltan dosis o las reducen para que sus medicamentos duren más. He visto niños que tienen problemas para respirar, que no usaban sus inhaladores para el asma, y niños que tienen un diabetes mal controlado porque saltaron las dosis de los medicamentos recetados. Y he visto familias que viven con el temor de no poder salvar a su hijo si padecía una reacción alérgica grave por no tener un EpiPen. Por eso es tan maravilloso que las subvenciones de MedAssist salven vidas con regularidad. Pero es tan maravilloso que las subvenciones de MedAssist hagan que sea fácil tomar medicamentos para diabetes que salven vidas con regularidad, usar sus inhaladoras para asma y tener EpiPens disponibles. En esto significa que los pacientes y sus familias pueden tener la tranquilidad de saber que tienen los medicamentos que necesitan cuando los necesitan. Y ahora, para hablar desde la perspectiva del paciente, las personas que reciben ayuda directa de MedAssist, me gustaría presentarles a Pamela Atkins. And now, to speak from the patient's perspective, the people who are helped by MedAssist, I'd like to introduce Pamela Atkins.
Thank you. Hi, my name's Pamela Atkins, and I am a patient at Valley Med. I've been fortunate enough to have the same primary care doctor at Moore Park Clinic for 20 years, Dr. Timothy Ong, and I've taken a lot of medications. I was disabled at 55, so I have been on Medicare. So while I have had insurance coverage, I have had trouble being able to purchase an additional coverage policy because of pre-existing conditions and all the medications. So when I got the phone call, they actually reached out to me via phone and said they had a program that they thought would work for me, and it was explained to me, and I was able to go online. The app is so easy because I'm almost 70 and I could figure it out. And if I did have a question, I was able to call them, and I always got an immediate answer. And they're just very knowledgeable about the program. I feel they put the time in to get it down before they started it out, and like having this and announcing it. I've been on it for about 9 months, and I just got my deposit yesterday. They send you a notice the day before, and then they send you a notice. And so, and for me, I am a diabetic and I have asthma, so I'm fortunate enough to get a payment for 2 medications. And I would encourage anybody to apply for this program. I'm not at the top of that 100,000 by any means, but that's the other thing I like about it, because I always, even when I worked, was in that middle, and it was just kind of pushed out. So the fact that they had something that was available for people more fortunate than me, that's what I think is great about it. So if anybody can get it, I would recommend it to them. Thank you.
Let me say thank you once again to all of our speakers today. Thank you all for being here. Thank you to the Health and Hospital and MedAssist staff who really make this happen. I know that. Come on up, Supervisor.
Sure.
Don't be shy. My colleague, as you heard, quickly doubled the expectation from 5,000 to 10,000. I know everybody over there is worried I'm about to go double the double. I won't do that to you now, but that day will come, so I look forward to it. Thank you, Supervisor, for raising the bar. And the last thing I want to say is, if you walk away with nothing else, keep this in mind. MedAssist, for Santa Clara County residents, MedAssist is money in the bank. That is the message I want you to take away. For Santa Clara, MedAssist is money in the bank. It also gives them longer, higher quality life. And with that, we're going to say thank you. Go out there and spread the word.